Hi, I'm Mark Geyer. I am an orthopedic surgeon specializing in shoulder, hip, and knee surgery. I became a physician largely because I enjoyed the sciences. I enjoy working with my hands, and I enjoy working with people that are active and want to become active again. And so just putting all of that together led me to orthopedic surgery. The common conditions that I treat largely are arthritis, as that is so prevalent in our society this day, but I also treat a large number of athletes, from ligament injuries, cartilage injuries, tendon injuries. And so my practice comprises a large part of joint replacement, but also tendon repairs and sports injuries. My current approach to patients really is a patient-specific approach. Technology really has allowed us to use advanced imaging such as CAT scans and MRIs to plan patients' surgeries largely before they even show up. And I am able to attach the parts or manipulate the parts that I'm going to implant or study the anatomy more closely so that I have a much better understanding of what I'm doing before I get into the surgery. I started covering high school football teams throughout my residency, had the fortune of working with the Duke University football team, was able to travel with them and learn that side of medicine. Being an on-field doctor is very different than being a doctor in the clinic, but using those skills helps to translate into taking care of people in different scenarios, different situations. They have expectations, seasons to get back to, a sport to get back to, and the like. And so marrying those two things has been really helpful. In the realm of orthopedics, I will often tell patients, I do not heal you. I just help put things back together where they should be so that they can heal. That's an important distinction, as the surgeries I do require oftentimes a prolonged healing time and rehabilitation time. And so having that understanding from the get-go is really important in order to maintain good expectations, both from my side and the patient's side. And so helping patients navigate that, understanding what to expect after the surgery. After the surgery is often much more hard than the actual surgery itself. So to be a part of a clinic such as this that has a long-standing relationship with the community is very appealing to me. It helps that we're in the setting that we are in that allows for patients to have easy access to the clinic. I think also with patients, just having the time to sit down with them, get to know their story, what they want to do, and how we can help is a big component of how this particular office can help patients with their orthopedic needs.